I think it's really important to be upfront about what we mean by prevention, because for many people, prevention means stopping people from using. It's a signal of a world of we say no to drugs, and that's not the notion of prevention that the Alcohol and Drug Foundation promotes. So our efforts in prevention are to strengthen the factors that protect people from alcohol and drug-related harm.
As one of the world's most misunderstood health issues, it's long overdue that we rethink how we view addiction. 1 in 4 Australians will struggle with alcohol or other drugs in their lifetime, yet many will wait years, even decades, to get the help they need because of stigma, a lack of available resources, or structural failures of the current healthcare system. On this episode of Michelson Alexander Explains, Senior Associate Aisling Acton is joined by the Alcohol and Drug Foundation's CEO, Dr. Erin, a recognised leader in the health policy and non-for-profit sectors, with over 20 years of experience as a clinician, researcher, advocate and leader. Aisling and Erin will discuss how society's view of alcohol and drugs is changing, how the ADF's philosophy of increased knowledge and accessible information is helping change behaviours around substance use, and how we can improve the symbiotic relationship between prevention and treatment programs. Before we start today's conversation, make sure you subscribe to Michelson Alexander Explains on your podcast platform of choice or via our YouTube channel to stay up to date with every new episode. And if you have a topic or theme that you'd like us to cover in future episodes, let us know by leaving us a comment or review. Now, here's Aisling and Erin.
So thank you for joining me today to talk a bit about alcohol and other drugs and some of the work that you do with the ADF, particularly in the prevention space. I'm really looking forward to picking your brain on a few issues. I think, more and more we're talking about not only what are the harms involved in alcohol and drug use, but also how do we kind of get in early and make sure that people are able to make informed, educated choices, and how can we make sure that people are supported to do that. I'm keen to hear about, from your perspective and the work that you do, how do you think society views alcohol and drug use?
So look, there's an awful lot of stigma around alcohol and drug use, and there has been for a very long time, and a lot of that has to do with misperceptions that people have around it. We've also got this very weird way of responding to alcohol in Australia, where there's stigma if you don't drink and there's stigma if you drink too much, but you've got to strike that happy medium. So I think alcohol and drugs, the way they're perceived varies depending on the substance that people are using, the background that person might come from, and whether they themselves are using alcohol and drugs. We've certainly seen in recent times a real shift in community perceptions around alcohol and drugs and people who use them. And I think that's got a little bit to do with a growing understanding of the fact that a health-based approach is a much better approach to responding to drug possession in particular, but also the changes that we're seeing internationally with legalisation of cannabis in many countries is really starting to shift people's perceptions. Medicinal cannabis itself has also started to shift people's perceptions around their views on alcohol and drug use.
Do you feel like the way that we view, use of alcohol and drugs has changed in Australia at the same pace that it's kind of changed in other countries like Canada and the US?
Well, I think it's hard. If you're talking about population level, we're probably not far behind. There are groups of people within Australia who are much more progressive when it comes to particularly drug reform. And we're seeing that group grow more and more over time. Certainly we know that laws will change perceptions as much as perceptions change laws. So in parts of the US and Canada where cannabis is now legalised, I think people are understanding that the sky hasn't fallen in. We've seen that in the ACT here in Australia, where the ACT changed laws around cannabis and people realised that the sky didn't fall in, and that just allows people to be more ready for progress over time.
We have two conversations going on at the same time, and I'd be interested to get your thoughts on this, but I do think sometimes society does view, recreational use quite differently to what we would call problem alcohol and drug use. Do you think that the way that we define addiction and the way that we talk about it impacts on that stigma? And do you think that there are ways that we could kind of change that conversation so that we could, I guess, bring those two types of drug use. Obviously, there's a spectrum of drug use, but if those are the two dominant conversations, we could kind of bring them to the same point instead of, I guess, welcoming one type but punishing another.
I think there is a growing understanding amongst people in Australia that many people who use what are termed illicit substances are often used by people without significant harm or need for treatment. It's only about 10% of people who are using drugs that will seek treatment or want treatment or need treatment. And that understanding that there are large groups of people who are using all sorts of drugs, whether it's heroin or methamphetamine or cannabis or alcohol, do so without needing really significant help. One of the things I think about the term addiction is that it does signal that really we only need to do something when people are experiencing that level of harm. And yet we know that recognising the signs of problematic use and dependence very early can help someone get support earlier, which makes it less of a burden on themselves and their family and on the system. We know people delay help-seeking behaviour for a very long time, and often it's because of stigma. But also I think getting people to understand that you need to think about harm reduction at every step of the way, that we aren't just talking about policies or support for people who are experiencing what the term addiction indicates, that we really want pill testing and supervised injecting rooms and changes to drug laws and better regulation of alcohol. And all of those things will reduce harms as opposed to necessarily stopping people from using alcohol and drugs.
I'm really glad that you mentioned that, because I am keen to talk about the work that we can do to educate people. And I think, it's pretty impressive that for a lot of topics that I think are still quite taboo and a bit seen as quite messy to talk about, and people don't really want to get into the details, the ADF does have a huge amount of resources to educate people. From your perspective, working in this space, how do you think that having that access to information helps people make informed decisions and kind of changes their experience with alcohol and drug use?
The Alcohol and Drug Foundation strategy is really to understand what works and then to enable that change so that people adopt the things that work. And that's as much about the individual who's using alcohol and drugs as it is about governments that are developing policy around alcohol and drugs. And being informed, knowing what the evidence says and what the evidence doesn't say, where there are gaps, where there's good evidence about something that might work or something that won't work, we can help people understand that particular information and use it either at a policy level or at an individual level to really start to drive change. And by providing people with knowledge and information, we're giving them the resources, as you've said, to make informed choices, that they can understand their own use of alcohol or other drugs, and they can make decisions about the way they use, where they use, how much they use, and who they use it with, and do so in a way where they're less likely to experience harm than in another circumstance. So for us, information is empowering. It's empowering for an individual, but it's also a way of influencing government, which is really important to us. We know that the system at the moment is not supporting positive outcomes, particularly for people who use drugs, but also for people who use alcohol. And there are a whole number of opportunities for us to change policy to reduce that harm.
And I think that kind of leads into another conversation around the relationship between prevention and treatment. So I'd be very interested to get your thoughts on how you think prevention and treatment kind of work together, because I think we often talk about them as two separate things, but I do actually think they have quite a close relationship. I'm interested to hear your thoughts on how you think they kind of work together in the AOD space to achieve better outcomes for people.
I think it's really important to be upfront about what we mean by prevention, because for many people, prevention means stopping people from using. It's a signal of a world of we say no to drugs, and that's not the notion of prevention that the Alcohol and Drug Foundation promotes. So our efforts in prevention are to strengthen the factors that protect people from alcohol and drug-related harm. So we know that connection to family, peers, community, employment or school for younger people are really important protective factors. We know they've been knocked around, particularly in the last couple of years by COVID, but there are other natural disasters, bushfires, floods, that have really impacted resilience for people. And we see after natural disasters like that and pandemics that alcohol and drug use does increase. And with an increase in use, we can sometimes see an increase in harm. And particularly in young people, where we know with alcohol that it does affect a brain that is still developing. So we really are working to delay that uptake of alcohol until people are older. But the work of prevention is about those protective factors. And so when we talk about the link with treatment, one of the things, if we do prevention well, we'll see fewer people who are needing treatment. Those protective factors protect against harm across that continuum of use, through that early experimental stage to regular use to potentially problematic use. So getting strong protective factors will help people throughout that process. So prevention will, one, hopefully reduce the number of people who are needing treatment. If people do want treatment, they will be able to get access to it earlier, and they'll have the right sort of protective factors around that give treatment the best chance of being getting them to where they want to get to.
Like, what should we be doing and what should we be looking to do to kind of strengthen that relationship? Because I feel like what you've described is almost like the ideal, but we know, and anyone who's had any involvement in the AOD space knows that for so many people that's not the case. So what do you think even like governments or organisations kind of working in this space should be doing to really nail down that relationship between prevention and kind of health-based attitudes and that access to treatment?
Look, I think there's been a lot of work happening over the last number of years that are seeing us do more in this space, and one of it is working together. So people in the prevention, information, education, treatment space starting to jointly call for change that will reduce harms. I think that's one of the things that's really, really important. Giving space for the voices of lived experience, and not just the voices of lived experience from people who are experiencing really significant harm and dependency from alcohol and drugs, but people with lived experience from a really diverse group of people who use drugs, to really start to remove the stigma that is, if you use drugs, then you've got to have a problem. I mean, that's just what people think. So when we have people who talk about their drug use and it has been a problem, we just reinforce that myth and perpetuate the stigma. So I think diverse voices gets us to understand that actually drug use can happen without significant harm, and for some people is a really important part of their world. And I think the other thing is to stop seeing it as one or the other. Like, if we are going to really address the harm that people in Australia experience from alcohol and drugs, then we can't do one or the other. We have to do prevention and treatment and early intervention and harm reduction. Like, we've got to do all of those strategies to be able to really see happy and healthy people in a world where drugs are a very real part of it.
Something else that I think we often forget about is the role of social connection. And I know that this is something that the ADF talks about quite a lot. What is the role, from your view, of social connection in kind of helping people make healthy substance use choices?
Look, social connection, as I mentioned before, is one of the key protective factors. It's connection to family, to peers, to school, to employment. It's connection to things that matter. And all of those sort of areas of connection that I've just mentioned will vary from person to person. For someone, peers might be more important than family. Family might not be the thing that really is the social connection they need. And I think it's one of the things that we work so hard on in the prevention space is just helping people understand how you can create a system that enables people to be as connected as they need to be to the things that matter. And if we can help people build those protective factors around them, then the harms that they'll experience will reduce. And I think it's fair to say as well that for many people, drugs are actually a way of strengthening social connections. They're really important within the peer groups that they live within. And when we talk about diverse groups of people who use drugs, it's important to recognise that, as I've said before, for many people, drugs are actually really adding value to their lives for a whole range of reasons, and that means that the harm isn't necessarily for them as great as the harm might be for others.
While we're talking about social connection, it's really interesting kind of looking at the Icelandic model and the way that they try to kind of, I guess, instill those healthier behaviours and ways of talking and thinking about alcohol and drug use a lot earlier on. I don't think I would do it justice. Would you mind talking a bit about what that model is and the types of things that it tries to target?
About 25 years ago, Iceland had, amongst its young people, the highest rates of alcohol and drug use, cannabis and tobacco use in Europe. And they sought to understand why. And through research that they did, they recognised that there were 4 domains that were predictors, if you like, of very high rates of alcohol and drug use and harm in younger people. So we're talking people under 18, youth. And they developed what's known as the Icelandic prevention model, and the basis of it is actually measuring the strength of those protective factors. So it's very similar to the Australian Local Drug Action Team in every other aspect of its operations, apart from the fact that it really does collect really good data at a grassroots local level about the strength of protective factors in young people. So what's their relationship like with their parents? As family is one of the domains. What's their relationship like with their peers? Because peers is a domain. How engaged are they in school? What do they enjoy and don't enjoy about school? Because school is another domain. And then what's their out-of-school activity look like? Because leisure and extracurricular activities are also really important in supporting preventing harms in people under 18. So over the time they've been running it, so what they do is they look at a community and say, could we do more to strengthen the relationship with family? If that's where they identify the gap, they focus on the family, not on the alcohol and drugs use. In fact, often they don't even talk about alcohol and drugs. They just focus on those school, peers, family and out-of-school activities. And they seek to strengthen those factors, and they see a reduction in alcohol and drug use. And they've now dropped to some of the lowest rates of alcohol and drug use in young people in Europe in that time. And we have no idea if this will work in Australia. Every community is different. We're trialling it in communities in South Australia and New South Wales. We've just completed the second survey. Seen some really interesting patterns of change in that time. So we surveyed young people before COVID and after COVID. So we've seen more alcohol use in the home. We've seen parental attitudes to alcohol change so that they're more permissive of alcohol use and children under 18 using alcohol. And that's likely, I expect, to have a bit to do with the pandemic we've all just lived through for the last couple of years and the fact that many Australians start to consume more alcohol in the home.
When we look at people with problematic alcohol and drug use, it's often the tip of the iceberg, and there are so many other factors that need to be worked on first. So I think if we can work with communities to build this system where they're looking after people in the way that works for them, rather than having someone coming in and saying, this is a program that you have to do to get better, and we're figuring out what the underlying issues are. As you said, without even talking about the alcohol and drug use, sometimes it will just sort itself out as a result of that, because so often people with alcohol and drug issues, what they really need is secure housing, or they need a community, or they need to feel like they have people around them who are looking out for them. So if we can address those factors, then we can start talking about the alcohol and drug use. But if we don't address those factors, then we'll only get so far in that conversation.
Yeah, I think that's right, and I think that's right, and I think the other thing is that again, we can have conversations about what a solution might look like with the lens of people who are having problems with alcohol and drugs. The Icelandic model is really about making sure that they don't ever have problems with alcohol and drugs. They don't experience the harms that we see so many people experiencing. So, and it's similar to what I was saying before. The Icelandic prevention model, and prevention's not going to be the silver bullet, like we're going to need a whole of system approach, a whole of government approach, addressing some of the social determinants. There are some people who are way more at risk of harm from alcohol and drugs than others. We need policy change, we need prevention, we need better treatment, we need harm reduction, we need education, we need all of it to sort of reduce the harm across a very large group of people who are at risk of experiencing that harm.
It's definitely something that we should be pursuing and talking to policymakers about. A lot of those things that you just mentioned, all the various things that we need to work on as part of this discussion around reducing harm, were topics that did come up at the recent Rethink Addiction National Convention. And there were a lot of common themes around educating people early, making sure people have the resources, making sure that we're supporting them to live healthy and fulfilling lives away from their decision to use alcohol and or drugs. What do you think was your biggest takeaway from the convention as someone who already works in this space?
Everyone who went knew that the voice of lived experience is so critical for change, that we won't get change if we don't create a space for those stories to be told. And you're right, through those stories we talked about the various points at which we can see change that will reduce harms, whether it's very early on, whether it's education, whether it's social determinants, whether it's policy regulation, whether it's industry behaviour. I think we heard appalling stories about industry behaviour in a poorly regulated environment. So really elevating those voices of lived experience and putting them front and centre of why we need change and what that change needs to look like was really powerful. As I've said before, I think the flip of that was that we only heard from people who had experienced really significant harm and dependency. And so we missed the voice of people who show the diversity of people who use drugs and show the diversity of outcomes for people who use drugs and alcohol. So just for me, walking away, it was really important to make sure that voice is given an opportunity to be heard by the right people in the right way and supported to do it. Reliving awful experiences is really challenging and in its own way inflicts harm, and I thought people were really supported through the convention to be able to tell those stories. But the takeout for me was, let's hear from the people who know firsthand why change is so important, about what that change needs to look like, and let's make sure those voices are diverse.
I don't think I've ever been as convinced that we need change right now as I was in that room. Like, you could talk for hours with policymakers and organisations on the ground and people working in the field who don't have lived experience, and we all agree on what the outcomes need to be. But hearing from people who can tell those stories of what they actually go through on a day-to-day basis and the ways that they've been let down by the system, but also the ways that they found community to kind of fill that gap that isn't being filled by the services that have a responsibility to look out for them was also pretty incredible. And seeing how people have just stood up and taken on that job themselves, even though you could argue that they shouldn't have to, it was pretty inspiring. And definitely, I think we have a whole group of people now who are pretty energised to go out and tackle some of those issues head on. Well, thank you so much for joining me today. It's been really great to hear about some of the work that you do, and I think you've raised some really excellent points around the way that we talk about alcohol and drug use and the way that we think about prevention as preventing harm rather than preventing people going near alcohol or drugs at all, because we know that that doesn't work. And yeah, I think the ADF is doing pretty incredible work and really leading the way in terms of making sure that people are supported and educated and setting the expectation that that is the model that we need to be looking for if we want to reduce harm. It's not telling people that they shouldn't use drugs. It's saying to them, we know you're going to use them, but let's have a chat about how you can do that safely, and we're here to support you and make sure that you're able to make those informed choices.